So, may have played this game before. It's called Plague Inc. And when you play it, the strategy that is most often employed to win the game is you first need to develop a very, very weak virus that is very easily transmitted. And by creating this very weak and easily transmitted virus, you allow your virus to spread throughout the entire world. And then only after getting your virus spread throughout the entire world, you then mutate your virus into a deadlier and deadlier strain so that it ends up killing the entire population. So that isn't exactly, and when I say it isn't exactly, that is very far from what actually happens in the real world, where you end up mutating a virus. It doesn't mutate all viruses across the world equally. Rather, if you mutate a virus and that particular virus tends to be deadlier, or that particular strain tends to be deadlier, then what ends up happening is that it basically has to start from ground zero. It has to start its infection all over again to try to infect the rest of the world. And so, granted, there could be piecemeal mutations that take place that make it easier for those deadly mutations to mutate throughout the entire world. However, it is happening at a situation by situation basis. So that is one of the ways that Plague Inc. really differs from reality. However, this is when we are putting too much our focus on genotype, or changing the genes to change the effect of a virus. But there are other ways that you can affect the virulence and affect the deadliness of a virus without changing its genes. So here I have a small presentation. So with Plague Inc., you basically buy these mutations and they affect all the forms of the virus throughout the entire world. And so this is not true for real viruses in the real world. So only individual strains will mutate. However, if there is a more lethal or transmissible strain that is the result of a mutation, it needs to start from the very beginning, which is what I was saying earlier. Granted, this could be happening throughout the entire world where deadlier strains come up. However, they're all starting from zero. However, we are focusing on the genotype changes. We're not focusing on the phenotype. So how can a phenotype change? Well, you can either change the virus itself, or you can change the environment that the virus is in. So think about this nature versus nurture argument. So your genes, your nature, can dictate a lot of the things that happen to you as an individual as you grow up in whatever environment you're in. However, there's also the nurturing aspect, where the environment itself is playing a huge role in how you develop within that environment. So, is there a way, if we can't change the genes of all the viruses at the same time, can we change the environment of all these viruses at the same time? So, let's see. Well, what is the environment of the host organism? It is the host. The host is the environment of these viruses. So is there a way to change the hosts of viruses? And actually, we do. We frequently do this. Whenever there is an outbreak, we tend to tell the hosts, hey, socially distance yourself. We learn better pharmaceutical techniques. We find prophylaxis for certain viruses, and we actually will make the host a less and less hospitable environment for the virus. And that is one way of changing the phenotype of the virus as it progresses from the epidemic into the pandemic stage. However, are there strategies that the virus can employ to change its environment across all of its hosts? Can it change the environment to make itself more successful and better at damaging its hosts? Is that possible? So, how would we do this? So this would be a long-term strategy. And so, for instance, in Plague Inc., the weaker and less deadly virus you had, you basically had apathy in humankind, So when you have the weak and less deadly viruses, humankind is more apathetic to that disease because it's not hurting us the way it would normally. It's not hurting us in a way that makes us defensive. In fact, we are very brazen when it comes to diseases that are actually pretty mild. So the mentality is, if I get sick, I get sick, but I'll get through it and I'll be fine. However, um, this makes it, how to phrase it, on the converse, a very deadly virus. Mankind will change its environment very effectively. We will stay inside our homes. We will refuse to go out into the marketplace, or we'll get agoraphobia. We will try to avoid large groups. That's what happens when you have an extremely deadly virus. Normally, there are some cases culturally that can prevent this from happening, but for the most part, if there's a deadly biohazardous disease going around that is extremely lethal, we tend to protect ourselves because of it. We change the environment. So, how would a virus take advantage of this? Well, they would first try to make it so that humans are not afraid of it. We will welcome it with open arms. It will Trojan horse itself in by saying, I'm not deadly. I am not a deadly virus. So it's okay if you get infected with me. Okay? But the Trojan horse in of itself wasn't the problem. So let's continue. Antibody-dependent enhanced. Oh, so a virus has to have a weak phenotype in the beginning, but a strong phenotype later. So how can this be accomplished? How can a virus emulate what a Trojan horse does? A Trojan horse appears benign. It appears benevolent. You can let it in and it's fine. Nothing bad will happen. But it's not the first time that you let your guard down that screws you up. So what we're talking about, what strategy can this be? Well, there's one, and there's one that coronaviruses are pretty well known for. It's called antibody-dependent enhancement, and this is a possible strategy to re-emulate this weak at the beginning, strong later effect. So what is antibody-dependent enhancement? So focus, there we go. So when you have accurate and sufficient antibodies to fight an infection, those are called neutralizing antibodies. So these antibodies are very good at binding to whatever epitope or whatever antigen it's trying to find, and it binds it very well. So that is the accurate antibodies. And then you need sufficient numbers of those antibodies for it to work properly. So if you have enough antibodies, they end up coating the virus, and they end up really giving strong signals for white blood cells to come and consume, phagocytose, those virus particles. It's also very good at, makes it better or easier to find cells that are infected with the virus, and therefore you can really take over, you can reduce the numbers of these viruses. However, not all antibodies are like that. So some antibodies can be a little inaccurate. It's an imprecise science. It's more like an art rather than an exact science when it comes to antibody production in the cells or in the body. So these antibodies might not bind very strongly to the virus. At least the first round of antibodies might not bind very well. So that's one way to have weak antibodies. Another way is if the concentrations get very low as well. Focus, come on. So another way is if the antibodies are not in high enough concentrations. And so what can cause this? Well, for one, very frequently, antibody concentrations will go down as you age. In fact, that is both your IgMs and your IgGs. Those will very frequently decrease in concentration. So for instance, this is why we sometimes need booster shots for vaccines to really keep our antibody levels high enough to fight certain infections. So when this happens, the antibodies, and if you do not have enough of these antibodies, if you do not have neutralizing antibodies, when this happens, the antibodies will bind to the virus, but it will not inactivate it. It will not be sufficient to stop the effect of the virus. So what will happen is the antibodies will then stick to a white blood cell's Fc receptor. So these white blood cells, to detect antibodies, they have these receptors which will bind to the tail ends of these antibodies. So this is the problem though. If you have a very weak antibody, but it's strong enough to bring a virus particle and a white blood cell very close together, then you have the problem with the virus. It doesn't care what cell it's getting close to. As long as that cell has the reproductive machinery, this virus will come in, stick to the white blood cell, and then the white blood cell has proteases on its surface that will cleave the virus and allow the virus to insert itself into the white blood cell. However, it's not inserting itself into a bubble of the white blood cell. It's actually inserting itself into the cytoplasm of the white blood cell. And this is bad because now that is an infected white blood cell, not a white blood cell that just ate a virus. So the problem with this is antibody-dependent enhancements is known and is very effective at making diseases worse. So what is the significance? Well, this changes the phenotype of the virus without changing the gene. So a virus can do this, have a first round, and change the entire landscape of humanity. And then when you get reinfected, let's say 3 months, 4 months later, when your antibody concentrations go down, then it becomes a much deadlier pandemic. It actually is killing people the second time around, whereas the first time around everyone was fine, or most people were fine. So this would allow a virus to spread easily without detection, but only become deadly in the later stages. So, final question, does corona do this? Yes. Corona viruses are studied and known to employ antibody-dependent enhancement strategies in their host organisms or in their victims. And so does SARS-CoV-2 do this to any significant degree? There is some belief that this happens. So there are cases where people are testing positive for the virus for significant periods of time. So this would indicate subneutralizing or very close to subneutralizing levels of antibodies. The other issue is that there appears to be people who test negative and then test positive later. So this would indicate that the virus is able to ramp up production, at least for periods of time, after the antibody levels get down a little bit. And another possibility is that, or another piece of evidence, is that when we're trying to do the modeling for the severity of this disease, it appears as though these non-pharmaceutical interventions and these stay-at-home orders and these physical separation, it appears as though the transmissibility of the virus absolutely plummets when we do that, far, far, far below what we would normally expect if we are actually employing social distancing. So what would this indicate to us is that out of the people that are showing at least moderate symptoms and that we do test for, it appears as though the coronavirus is only infecting a subset of the population. Or I should say it's only able to infect a subset of the population. So it appears as though the logistic curve of who gets infected with this virus seems to plateau very quickly. What can cause this? Well, something that could possibly cause this is if you need to be infected twice before you even show even moderate or even extremely mild symptoms. So that is something that could indicate that SARS-CoV-2 is employing this strategy, and that you need to actually be infected twice before you can even get detectable levels of virus in the first place. So that is one indicator. Another indicator is that this is happening this happens in MERS, where if you don't have sufficient levels of antibodies, we know that MERS coronaviruses are able to employ antibody-dependent enhancement strategies. So MERS is the Middle Eastern Respiratory Coronavirus Syndrome coronavirus. That we know. We know for a fact that those can infect white blood cells using antibody-dependent enhancement. And with all the other coronaviruses, except I don't know about SARS because I don't believe we've done those studies yet. We lose antibodies to all the other coronaviruses very rapidly. It does not take long at all for us to be reinfected with a normal, typical human coronavirus. It's between 3 and 6 months before your antibody levels get low enough that you can get reinfected. So this aligns pretty well with the woman in Dallas-Fort Worth who was reinfected, actually genuinely reinfected, where she got infected in February, tested positive in February, recovered, healed, and she was actually donating her plasma because her plasma had neutralizing levels of antibodies. And yet, she caught the coronavirus again 4 months later. And that 4-month window is about the amount of time we would expect someone to lose immunity to a typical human coronavirus. So, does SARS-CoV-2 utilize this strategy to become a superior Plague Inc. type of virus? Maybe. So with that, thanks for watching, and if you have any questions, leave them down in the comments, please.